how the world of fashion and science have collided for something really unique called HIV Unwrapped. That's what we're talking about today on Plus Talk. Joining me all the way from my hometown of Melbourne, Australia, is James Nuttney. He is a fashion designer, and James McMahon, who's an infectious disease clinician. And we're speaking to you guys. You're at the Alfred Hospital right now. Is that where you guys are?
That is correct. We're at a big city hospital in Melbourne, Australia. So apologies if we get some crazy announcement in the background about some patient needs to be run off to. So we can't avoid that. But that's
No worries, but thanks for the explanation. So HIV Unwrapped, this is kind of fascinating. As I said, science and fashion. James McMahon, just tell me, what is HIV Unwrapped?
So it was an incredible project to bring together scientists and designers and put their ideas into a fashion garment. The lab coat actually was the idea, sort of redesign a lab coat, but the end product, unbelievable. And including James's that was involved with my science. So they're incredible. So that was the idea.
So how does an idea like this, like HIV Unwrapped, bring that incredible science and research to life, I guess, through fashion in your mind, that makes that sort of science easy for an everyday person to understand?
It just brings this science to a whole different audience. It transforms the way people think about the science. You know, science is nerdy and, you know, there's a lot of technical terms and sometimes it's hard to penetrate. I spend a lot of time actually in my work with patients or people that are not in my field, translating the information, trying to put it into lay language. And this is another way of doing that. And the things James come up with, I just could never have thought of perceiving what I have been doing and putting in that way. He did it completely on his own. And it just generated so many discussions and conversations. The garment created conversations about the science. It made people understand that people with HIV who could potentially be in the trials that we're doing, other scientists understood it better, and people with no scientific background at all. So it's just another way of us trying to translate and get our message out there in a completely different way. And we just need to do more and more of that actually in our science.
James Nuttney, as the designer, you know, you're dealing with science, you're a fashion guy. What would you say was, you know, the hardest part for you on this project?
Oh, I guess, I mean, coming into the whole assignment from the start was a massive challenge. I remember like sitting down at our first meeting when I first met you. I'm a big biology guy, I did it in high school. I really found that interesting. But yeah, my first sort of feeling was, how the hell are these two going to collide? And it just took a lot of experimentation and trying to build connections. I mean, I'm a very visual kind of guy, so taking things I could see from James's research and using them as like visual cues in my design was really helpful.
Yeah, I mean, you're both coming from different worlds. I mean, was there anything about each other's work that, you know, really surprised you, or something that you weren't expecting to learn along the way?
I remember this is the research is about a study giving a medication called nivolumab, which is normally used in cancer. And the idea is that it could get at the last bit of HIV in someone's body. It's this HIV cure field, right? So I sort of explained that a little bit to James. And then James went away on his own and started Googling and trying to find imagery that related to the drug and the target in the body that the drug is actually going after. And you came up with this protein structure of the target of the drug, and that became the motif that was the basis of the garment. And you should describe it, like what you found this imagery, and then how did you put it on the garment to create the idea of the
Yeah, well, like I said, I'm very visual with my design. So a lot of other people who with their scientists kind of got like down the microscope shots of like their research. So I remember from my biology work in high school, the teacher showing us these 3D structures of proteins, and I remember finding that just amazing and super interesting. So I was like, oh, I'll try and draw on that and see if I can find like a 3D model of these proteins and kind of what makes them up. And they just made these amazingly complex and brilliant structures, which I kind of just screenshotted and made a big print for. And that was kind of like the leading aspect of my design.
Was that the moment, because I know that initially I'd read some notes that you had thought, you were pretty skeptical, I think, that something like this could work. So was that the moment when you sort of, with the protein structure, that you went, okay, actually this might be possible? Or was there another moment along the way where it all sort of clicked for you?
Yeah, that was definitely the like kind of turning point, because initially I was trying to come at it from a very like, I guess, poetic angle, like, which just wasn't really working.
What does that mean? What does poetic mean?
Like trying to dive into like how the patient's receiving this treatment and coming up with a response, like more like emotional, I guess, response compared to my actual response, which was very, I guess, geometric.
So you describe the finished product for me, James. What did you come up with?
So it was a full-length leather lab coat that had the the print that I came up with of James' research, laser etched into the leather. So it created this really beautiful, very subtle print that at first is kind of hard to see, but catches the light really interesting. And then had a sort of more exaggerated lapel to mimic the kind of rectangular structures seen in the structure of the proteins. And that kind of followed along to the collar as well. And then a sort of similar belt wrap around the side that kind of fastened under your arm.
And clinician James, what was your reaction when you saw the finished product?
No, I was just blown away. I really was. James laser etched this motif onto leather.
Wow.
In these sections. So you can't, if you're like 4 or 5 meters away, you can't see it. You get up close, suddenly these things start appearing to you. So you're drawn into the garment, and then suddenly you're having this conversation about what all these things mean. And that leads to the discussion, right, around the science and the research. And then suddenly you're discussing this research, maybe with people with HIV who are interested in being involved, other people who don't have a scientific background, and then translating this information to everyone. And then the other great thing, it's, the other way, it's 3D. It sounds ridiculous, but it's sitting on a mannequin. You walk around it, right? And there's different elements in the back and the front and stuff like that. So, yeah, I was blown away. Something I could never have come up with, never in a million years come up with myself. Like, I seriously would have got a white lab coat, looked for a picture of the protein and the drug.
That's why you're the scientist and the clinician, and James is the designer. You see, James designer. Beyond just sort of that idea of merging fashion and science, has working on this project perhaps given you a different way of thinking about HIV and its impact, maybe through a different lens than you had before?
Yeah, definitely. I mean, coming into the project, it wasn't super large part of my life, I guess. Like, I wasn't really exposed to much of it around. A few family friends I knew had it and are living with it. But yeah, it was really eye-opening. It has kind of opened a whole new world to me that I feel like everyone should kind of learn about. And, everyone around us, they could be living with it. And I feel like these stories need to be heard.
That warms my heart, and on so many levels to hear you say that. And I've got to imagine, James, clinician, similarly for you, for somebody, because so many people out there think, oh, well, HIV doesn't really affect me. It's a gay person's thing, or, it's just not part of my world. So when you hear a response like that from James, your collaborator there, how does that make you feel?
No, it's fantastic. And the other thing for me, I talk about HIV all the time, in my work with my friends, and I'm always communicating about HIV. People live long, healthy lives, amazing treatment, all that sort of stuff. But James is just describing, another sector of our community understanding, destigmatizing HIV, understanding we all need to understand about this condition. And then the other big thing about it for me, HIV is not as big an issue in Australia. There's a lot of people with HIV, but globally, it's an enormous issue for the world. And I always talk about this with, junior doctors and things. Despite all the gains we've made, 1 million people a year are getting infected with HIV, and 2/3 million people die every year in the world with HIV. And that's not the situation in Australia. But the work we do here, the reason why it's so important in the US is because the gains that we make and the discoveries we make here, they clearly can be translated to the rest of the world. the 25 million people in sub-Saharan Africa benefit from all this work as well. You don't really think of that, but it's definitely true. And why all these amazing advances have been made, a lot of it has been done. That research and that work has been done in high-impact countries as well. So it's just another way of spreading the good word and continuing on. It helps us do the science, gives us a kick on, helps us, apply for funding and keep doing all the research.
So finally, and this question is for both of you to answer. What's something you hope that people take away from this project, whether it's about understanding HIV or, as we've just talked about, helping, shatter the stigma that still exists?
Yeah, a couple of things. Like I was just saying that, these people who are living with it have voices and they can be shared. And like adding on to that fashion is a way to do that, and that can be, further seen as a way to break boundaries between things and build bridges like between science and fashion, which is, quite a difficult bridge to build, but it can be done and has been done. So, I guess seeing that, fashion is a tool to, I guess, share these stories with the world.
Yeah, that's sort of what I was getting at too. It's this idea of how can we translate, spread the message further, reduce stigma associated with HIV. I've had a bunch of conversations about this project with all sorts of different people that I wouldn't have normally had that, and that's just really important. So, when James says science and fashion, but it's just science, medicine, and all other sectors. This is one amazing example of two different worlds coming together. But the more we can cross those bridges outside of our sort of little bubbles that we're all in, that's clearly going to be good for the science and for people with HIV.
Yeah, well, listen, I think it's a fantastic project. Congratulations to you both. James Nuttney, James McMahon, thanks for getting up early, your time, and joining us on Plus Talk.
Thank you. Absolute pleasure. Thank you for having us.
That is going to do it for this episode. If you want more information, check out our website, pluslifemedia.com. And remember, you can always like, follow, and share. We're across all your favorite social platforms at Plus Life Media. Until next time, be nice to one another. We'll see you soon. Bye-bye.